Hi, doing a tech check. Hopefully we're good to go. So what we're going to do is we're going to go for a foam roller session today. So hopefully everyone's got a foam roller out there, but we need to do a tech check to start with. So can you give me some thumbs up, some likes, some loves? Anybody out there? Have we got anyone live yet? So what we need to do is go through a session where we're going to do a mobile session where we're going to mobilize using a foam roller. So if you guys are out there and you're seeing me live right now, type in live, give me thumbs up, give me some love, give me a wow. I love a wow. So for everyone that has a foam roller, we're going to do this. If you haven't got a foam roller, then make sure that you get one for next week. We're going to do a stretching session, and then we're going to do a foam roller and mobilize session each week to make sure that we do both together. They're really good at kind of like complementing each other, so that you stretch the mobilize, the muscle to start with, and then do some foam rolling. Again, the same sort of thing with everything else is, if you feel any pain, if you have an injury right now, then make sure that you stop what you're doing and direct message or call me directly. For everybody else, let's start using a foam roller. The foam roller isn't for everybody, so make sure that you, if you're not sure if you should use it, you should again contact me and ask me whether it's appropriate. So make sure that we kind of get the right information from you guys to make sure you're doing the right thing. So we're going to go do some foam roller exercises into our quad, into our adductor, into our hamstring. So these three muscle groups is what we've just done the stretching on. So if you feel any pain while you're doing the foam rolling, that's probably quite likely. So if you actually get pain in the joint itself, in the knee joint or the hip joint, then you should stop, or your back, you should stop what you're doing, but you should feel quite a strong pressure where the muscle actually gets inhibited with the foam roller. If you're not sure, you have an injury right now, or you're actually getting pain that's elsewhere than not where the foam roller is, you should stop what you're doing and contact us. So for everybody else, let's get cracking. So I'm Alex Watson, the CEO and Clinical Director at Australia Consultancy, and I'm going to take you through some foam rolling for your quad, your adductor and your hamstring. So first one is quadricep. We're going to lay down. I'm going to do it on the plinth, so it makes it easy for you guys to watch, but floor's fine as long as it's kind of a fluffy floor. Make sure you don't hurt your knees when you do this. So laying on your front in this position here, and what you're going to do to start with is going to use, depends how hardcore you are, you can use a smooth area or you can use the knobbly area. If you want to use the knobbly area, it's quite a lot more painful. If you want to use a small area, it's a little bit softer. So if you haven't done it before, I would use the smooth area. If you have, use the knobbly area. So rolling onto the side, so I'm going to do right side first in here, and you're going to locate the quadricep. You can feel that contracting as you do that, and it comes from the front of the thigh all the way down to the knee, and you're going to slide that underneath the front there and just lay it on one side. So if you can feel that pressure as you then roll off your left hip onto your right thigh and hold that in that position. So you're sort of like in a semi-plank position. If you can do that, it's great. You should feel a strong pressure on the front of the top of the thigh, the quadriceps, right at the top. If you feel any pain in your back where you're doing this, what you can do is you can drop your arms down, so you're laying flat on the floor with your arms underneath you. Or if you're feeling super strong, what you can do is roll onto that right hand side so you feel a bit of pressure. So we're going to go for a stretch reflex. What you're going to feel is a bit of pressure. That pressure will build up. That stretch reflex will take more than 12 seconds to occur. So you can feel that pressure building. And after a while, you'll feel that start to plateau. And then you feel it slowly start to ease. So I'm up on my left knee with a gap underneath my left hip. And as I feel that loosen, I'm going to then just roll up onto another spot. Either you can let it go onto a different spot of the foam roller or relocate it onto the knobbly bit. I'm going onto the knobbly bit there. So if you're feeling that pressure build, this area a little bit lower down will be a bit stronger. Again, if your shoulders start to feel tired or tight, just drop them down so you're underneath you, or in this position it will make it a little bit less strong, which is fine. I like it up here, nice and strong. And if you want to make it looser, then you can drop your left hip off, but you'll come off the muscle a certain degree. So I would recommend trying to keep that pressure up on that left hip onto the right side. As long as you're not getting any back pain, that's fine. Back pain, again, DM me. So if you're watching live, type in live in the comments on the bottom. If you're watching on the replay, I'd love to see a replay. And so that way we can make sure that we keep in contact and give you appropriate advice when you need it. So I feel like loosen off, so I'm going to roll up again. So I use the foam roller to inhibit muscle groups to loosen up locally. It causes a little bit less inflammation than rolling it backwards and forwards. It has a more of a neurological effect on the muscle to loosen it. It's a bit like an osteopathic inhibition technique. You'll feel that pressure build, keeping that in that place. Good. Now, if you want to make it a bit stronger, so I'm going to roll up again, what you can do is you can point your toe to contract the muscle, and that will allow the muscle to contract for a moment, and then you relax your toes, and that will give you a refractory period, a moment in time when the muscle will inhibit a little bit stronger for a moment, and that will loosen again. Good. And then as that loosens, you're going to roll up again. And so you can see my back's quite arched now. My back's quite strong, quite mobile, feels okay. But if you're feeling at this stage of nipping in your back, then just make sure you drop down onto your front to take the pressure off your back. You don't want to hurt your back or your hips as you do this. Good. And then the last one, just above the knee, a couple of inches above the knee. So if you want to make it stronger, bend that knee, bend that hip, and roll right onto it. You'll feel that very strong in there. So if you do have an actual injury in the knee, you need to be very careful to make sure that you only do this if we've advised it. Good. And then there's just one just here. That's great. So again, you can use that refractory period by stretching your toe out to contract the muscle group, and then relax it, and it will just allow it to get in a bit deeper. That's great. And so that's the center part of the quadricep muscle done. So what we're going to do is the same on the other side, but I'm going to give you a slight variance on this. So the quadricep is quad, 4 muscles. They all go down the front of the thigh here, 3, and there's a deeper one underneath it. What we're going to do now is we're going to do the same on this left side. So in this position here, laying, and then you're going to lean off on this side, and I'm going to then put it underneath this front of this thigh muscle here, just here. If you don't know where it is, if you just lift your leg backwards and forwards, you'll feel it contract in there. And then you're just going to lay on top of it. So this is the center part of the muscle, the main part of the quadricep, but a lot of us actually get tight on the lateral part of the quadricep muscle. So what we can do is actually go up even higher off our right knee and roll, so that we're going to straighten our right arm now and bend our left arm, and that will put more pressure on the outside of the muscle group called vastus lateralis, which is a muscle that's on the lateral part or the outside of the thigh. A lot more tightness on the lateral parts of the quadricep. And as that loosens, you can then roll up. And again, same again, straighten that right leg, right arm, so you can feel it more on the lateral part. If you want it on the center, it's a bit less strong. So you can hold it in that position there. You can feel it inhibiting each time and feel it loosening. If you want to make it a bit stronger, point that toe, 1, 2, 3, relax it, and it'll go deeper into that hip muscle, this quadricep. And then you're going to slide up. Again, if you want to go more on the outside, which most of us are a bit tighter laterally, we're going to go out onto the side like that, and you can feel that pressure building again. Good. And you've got to go through that cycle to get that looser, and then bring forwards. So you might notice again that you're feeling a bit imbalanced. If you're imbalanced, unbalanced, then type in unbalanced below. And so as you feel that pressure building, and you actually might feel a bit more tight laterally. So if you're feeling your back's arching, your arms are loose, or tied, sorry, just drop down, let that pressure build, point your toe, and then relax. If you're feeling strong, up onto here. If you're feeling super brave and you're tighter laterally, straighten that right arm onto your left elbow, and you feel it more laterally on that muscle on the outside of the quadricep. And you're going to roll up again, holding that position. So it's quite a good upper body workout if you're in that position. If you're too tired, just drop your body down on the ground, as long as you don't feel any back pain or hip pain. It's a very strong inhibition technique here. The thing you need to be careful about using foam rollers is they're very, very strong. They're like a sledgehammer, so if you use them a lot, they often cause muscles to be inflamed. So you need to be very careful how often you use them. I wouldn't recommend anyone using them more than every 3 days. Probably once a week would be sensible. And you should only be using it if it's appropriate. And then bring that one up. And it's the last one on the side of the knee here. Good. And making sure you don't get any back pain. If you get any back pain while you're doing this, then DM me. So we worked on the quadricep, the main part of the quadricep, and then we work that slightly different muscle, which is the vastus lateralis. So the next muscle we're going to do is we're going to work onto the hamstring muscle. So it's the back of this muscle here that comes through from the back of the pelvis into the back of the knee, and it gets very tight. You can do it lots of different ways. I recommend you guys doing it up against the wall, but I'm just going to do it sitting for you for ease. Again, you can choose what you're going to do. So either you use the knobbly bits, or you can use the smooth bits. So I'm going to use this as a pretend wall. So in this position here, we're going to kneel on this left leg, sit against the wall, and then you're going to put that knobbly bit just below the knobbly bit of your pelvis where you sit on, just on that right side, and on that position there, and you just hold yourself nice and upright. Classic thing is hamstrings get very tight on people that are office workers. So if you're an office worker, your hamstring gets very, very tight because the knee's bent for long periods of time. So the foam roller is really useful for straightening that out. Hamstrings often get very tight and they can put a lot of pressure on your back. If you feel that pressure on your back, then loosen up the hamstrings and quadriceps as well can help take pressure off your back, and obviously knees and hips as well. So this will help with your mobility. So as you feel that loosen off, this can take quite a while to loosen off. So you can hold it on for a lot longer than this, but you should move on each time that you feel it loosens. Every time you loosen it off, you should move on. Now that will be variable in everybody. My hamstrings are quite mobile, but if your hamstrings are very stiff, then you should make sure that you take a bit longer over this. Make sure you build it up. So if you haven't done the work before, then you do a little bit and build it up every 3-4 days or a week. What you don't want to do is you don't want to kind of go out, bull in a china shop, be one of those COVID crazies where you're going out crazy, doing too much too quickly. Just build up really slowly. Good. And then you can just bring your foot forward. If you don't want to do that, you can just literally drop your leg forward like this and then just balance it on top. And then you can just straighten your leg, which makes it a bit stronger, and then just relax it down again. Good. And so you can push off the wall into it so that you're coming off the wall with your elbows and hands. What I don't particularly like to see is them using their back, because you're just using your lever as a back. So you just want to keep putting pressure on that. That's really strong. Good. So any of my patients or anyone that's unbalanced in their hamstrings, then make sure that you're right unbalanced when we get it onto the other side. Anyone that's a live viewer, type in capitals, has to be capitals for live. And then if you're on the replay, make sure that you type in replay in capitals. You know I love my replay. So hamstrings, this is a really effective thing to do. I'm going to now do the left hand side. Again, I like to sit up and do this and start again, but if you've got pressure on your knees, don't worry about it. But I like to sit and then just drop straight on top of it, just below the knobbly bit of where you sit on, just below that, and you can feel that pressure really, really strong at the top of the hamstring. And you feel that can pull right the way down the leg. If it's too much, you can just take the pressure off and sit back off it slightly. Good. And you feel that pressure build, keep that leg nice and straight, don't let your spine drop forward. So if you're feeling lots of pain, stop what you're doing and go back to it. But if it's okay, it should slowly start to ease off. It takes that 12 to 20 seconds for that stretch reflex to calm. Good. And so mine are quite mobile, so I can move on. Some of you guys out there with your hamstrings might be really, really stiff. So make sure that if they're very stiff, you hold it on a bit longer and build it up. But if you're stiff straight away, make sure you do kind of a little bit one day and then do it 3 or 4 days later and build it up. Don't go smashing it and then you make yourself sore. Good. And then just going to go down lower in this position here. So at this point you can drop off it. And then in this position here, try not to lean forwards, trying to go off the wall and push off with your elbows and hands. Keep that leg straight and bring your toes up so you can feel that contract. Good, well done. It's a bit tighter on that point for me. And then relax your foot. Lovely, and then lean into it. So you feel a nice strong pressure, no sharp pain. It should just be a pressure pain in there. You shouldn't feel any real bad sharpness. If you do, then go from the knobbly bit to the smooth part. And then keep that going. So hamstrings are really important for office workers, for runners, for walkers. So if you're an office worker or you're a sofa surfer, which is a few of us are, you'll feel your hamstrings will get tight because your knee's bent. So that's the hamstrings done. We've got one muscle to go. So if you're feeling energetic, we'll do the last muscle. Here is the adductor muscle here, inside of the thigh. This one's slightly more awkward. So but you're going to lay down again. So if you lay down flat, and depends how excited you feel, either knobbly bits or flat bits, depends whether if you're a newbie, then start on the smooth part. If you're a pro, into the knobbly bits. Laying flat here, and what you can do, breaststroke stroke up to the side, and then you're going to lift your foam roller and put it in the inside of your thigh here, and then you're going to reposition yourself so you're fairly flat. What you don't want to do is leave yourself still on your side. If you're still on your side, you're not going to feel much. It's what a lot of people do. What you need to do is make sure you try and lay flat, picking your left hip up off the ground and pushing that into the thigh. Now, if you've got groin injuries or back pain or hip pain, this is kind of one that can kill or cure you. So have to be very careful. If you do have a back pain or you do have a hip problem or a adductor problem, then please message us directly so that we can give you appropriate advice. But if it's just a bit immobile or it's part of treatment that we've got at the clinic, then this is a great refresher. So as that loosens up, now this one will be a little bit stronger here. And we're going to then straighten up and really pick that left hip off the ground, balance off that left knee and put pressure onto the inside of your thigh. So these hip muscles, these adductors, are very important for sideways movements of the hips. So if you've got tightness on one side or the other, it makes you unbalanced. You know, I love my unbalanced people. We want to make everyone nice and balanced and get their mechanics and gait lovely. So you can feel that pressure in there building, and you can lean even further across. So bend that and put more pressure into the inside that thigh. You can chase it a bit more. Again, if you're a newbie, don't chase it, just go steady and build it up. So one more lower down on this right side. So what we don't want to do is go through the inside of this knee, just about here. There's the adductor hiatus, which is a nerve cluster comes through here. So you just want to be just above it, out to the side here, and then just keep yourself up and on it, nice and strong. If you feel any nipping in the hip, change your angle as best you can, try and avoid it, or go back and do some stretching before you start doing the inhibition work. That should help as well. And that will help free up the inside of the thigh. So this can take a long time, but my adductors are quite good. So chase that down each section. Good, it should be a strong pressure. So that's the right one done. So don't just sort of stand up off it, roll off it, bring it out and then come back. If you're feeling any pressure in your back as you're doing it, you can then let yourself drop down again. So go back on your front again in this position, breaststroke stroke up to the side, pop that underneath the inside of your thigh. I go for the knobbly bit, like it really strong. In that position here, remember to straighten yourself up. Now if you're feeling kind of pressure in your low back as you're doing this, or pressure in your hip, you can just, like the quadriceps, you can just collapse onto the ground. It makes it slightly weaker, but if it's that tight, it probably won't need it. I need a bit stronger, so I'm up onto my elbows, and then you can then lift your right hip up, put pressure on your knee, and that brings that pressure off your right hip into that left adductor muscle. You feel a nice strong pressure. And again, you've got to go through that stretch reflex again, about 12 to 20 seconds. And as that frees up, we're then going to roll it down. Good, in here. And then keep that knee nice and high. So again, any sharp pains, stop what you're doing, DM me. And if you're feeling it in your back or your hip, drop down. So, and you're in that position there, and then you're going to pick that hip up and hold that pressure on there. So you can build it. As you feel the muscle relax, you can build the levers to make it a bit stronger. So I can pick my hip up a bit higher and then push more pressure into it. Lovely. And then just go again, roll off, then roll on. So this last one, again, remember, there's a nerve that comes through the inside of your thigh, hands width there to just stay away from it. In here, and then put pressure on. And if you want to make it stronger, go up onto the knee on the right side into the left. And that's a strong pressure. So the sorts of people who should be doing this, you should be fairly young, fairly fit. If you're not sure and you're a little bit older, then, you know, give us a message and ask us some more advice. This is very useful to add on to your stretching routine. So if you're doing a stretching routine and a foam roller routine every week to keep your mobility up, that's really good. Good, and then you just take it off. You're going to roll off that side, bring it up, out the way. Obviously you're on the floor and stand up. So to give you a bit of a recap, we've inhibited the front of the thighs. We gave the option to work into the outside of the thigh, also worked into the hamstring, the inside of the thigh. Those are inhibition techniques. It's great for increasing our mobility. I've really enjoyed today. So if you guys have any questions or anything else we want to see in the future, then just drop us a message. I've really enjoyed it. Any questions or problems, then obviously we're always here to help. Anybody that hasn't got a foam roller, get a foam roller, because next week we'll be doing further up. We'll be doing mobilisation of the hips and spine. Before now, I'm loving helping people. If you have any other questions, give us a call. Otherwise, we'll see you with a good technical next week at 2 Saturday. All the best, guys. Bye-bye.